I'm Claudia Morandi. I'm the founder of the Don't Punish Pain Rally organization and also the Doctor Patient Forum. My advocacy started 4 years ago when I noticed how horribly pain patients were being treated. Eventually, my advocacy would bring me to the Doctor Patient Forum, where I would start to advocate for doctors who have been targeted by states' medical boards who work in tandem with the DEA. I have 50 chapters, and I also have a chapter in Australia, UK, and Canada. Now, the reason I'm doing this video, making this video today, is I am appalled by how patients are being treated in the hospital. And while I empathize with doctors, pain management doctors who are fearful to prescribe because of what's happening with the DEA overreach, there's absolutely no reason a surgeon cannot treat your pain after they've performed surgery on you and you're still in the hospital. If I don't get a weekly request to advocate at the Cleveland Clinic, I would be lying. I am called in frequently to advocate for post-op suffering at the Cleveland Clinic. I was just called in to advocate for a 21-year-old lady who had a total colectomy and anastomosis done yesterday morning. I think that's the correct term. I've had that surgery. I've had Crohn's disease since I was a kid. And I remember the pain was just excruciating. But the hospital, I was at a small Jewish hospital in Providence, Rhode Island, and my colorectal surgeon was a wonderful, compassionate doctor who kept me comfortable. And this poor kid, I say kid, she's 21, I'm 52 tomorrow. The doctor just went in and said to her, "You shouldn't have pain." No, they did this surgery yesterday. This is a colorectal surgeon. His name is Dr. Gorgun, Gorgun. Dr. Gorgun, let me tell you something. Have you had a colectomy? And did you manage it with gabapentin? And how dare you take your patient downstairs today to give her a nerve block instead of treating her with pain medication? What the hell is wrong with this surgeon? What is wrong with these surgeons, period? Cleveland Clinic gets millions of dollars for not treating patients' pain post-op with opiates. But think about the post-traumatic stress you're creating when you leave people to suffer. This is all in an effort to cure the opioid crisis. The message I want to leave with who's ever watching this is, don't go to the hospital, cancel all elective surgeries, bankrupt surgeons. The only time you should go to a hospital is if you're having a heart attack or a stroke. There's no other reason to go to the hospital for any surgery. They are cracking open chest without giving people pain medication. And there's no reason that your pain shouldn't be treated when you're in the hospital. Say no to the surgeries, bankrupt the surgeons, and demand justice, because there is nothing different what's happening today than what happened in the Holocaust. Pain patients were referred to as useless eaters. Today they're referred to as superutilizers. Pain patients have been deleted from the country because they're a burden. And this all stems from the HHS, the National Pain Strategy, the 2016 CDC guidelines. But most importantly, take one thing away from this, YouTube. There's millions of dollars, billions of dollars. People are profiting. Your senators, your congresspeople, they're all profiting off your pain. They're profiting off of Suboxone. They're profiting off of buprenorphine. And millions are being forced to undergo torturous post-op surgical, horrible procedures. Cleveland Clinic prides themselves on being the home of the opioid-free mastectomy. Say no to the Cleveland Clinic. I know you're suffering. I wish I could answer every request to advocate, but it's simply impossible. My partner, Dr. Arnold Feldman, has been targeted by the Louisiana State Medical Board. This is probably the most despicable vile medical board there is in the country, but they're all despicable. Let me tell you why. Because they all have qualified immunity, which means they're running rampant. They can do whatever they want. Not for long, because I have a funny feeling a whole lot of things are about to change. Hang in there. Join that Facebook page, Don't Punish Pain Rally. The doctor-patient forum is where we do all our advocating. I know you can't get the pain medication you need. I know Suboxone's being forced down your throat. If you're not a person who struggles with addiction, say no to Suboxone. Bankrupt Indivior, their day is coming, just the same way Purdue's day. Hang in there. We're working 24/7 to bring you help.